So I'm here to talk on this particular topic, plant-based diet, the future of CVD. I am Dr. Rajendiran, and I would like to introduce myself as someone involved in nature. These are my photographs. I'm not a photographer, just an interest in my nature. And recently I've started doing this work also. This is from my terrace. And the most important thing, who have made my change far better than what I was, less stressful. I've got 2 pets, and this is the diet. I think it's like what Dr. Regina showed in the last few slides. This is my routine breakfast, not much of a change. It's all, everything is there in this, and got into other modes of lifestyle also recently. Now, I wasn't like this earlier. Any guesses as to what this is? Yeah, I told you I'm a cardiologist. I was doing certain interventions other than the cardiology also. This is a hepatic vein occlusion. This is, I know you must be knowing about Chiari syndrome. So on to your right, you will see that I've opened up a hepatic vein. This is in 2000s, when this was not known in my areas, at least. So I think I was only catering to this tip of the iceberg, and when I realized that I should do more, my work has become less. Okay, more of talking now. So these are the 4 things. Dr. Regina was pointing out a slide which was this way, and I'm showing it from the bottom. Okay, so here we all should be actually focusing on behavioral changes. This is 6 behavioral changes which the lifestyle medicine focuses on, but we are focusing on the physiological changes, namely the risk factors. That is precisely what she was telling. And I do focus on subclinical atherosclerosis also. So these are the 6 pillars of lifestyle modification, which every one of us must be following, of which PAN focuses exclusively on diet. Why is that so? Because I think in the previous 2 speakers, they have already spoken, so there is no suspense over here. 56% of the diseases arise because of the dietary factors. And amongst the dietary factor, again, this slide was shown by Dr. Regina. When we actually be ourselves or our own doctors address the patients, what is the risk factor for coronary artery disease, we are used to telling what we take very much in our food, like the saturated fat or all that stuff. Actually, we see that in here, it is all in the bottom of the list. And what is the major risk factor is what we don't unfortunately take. Okay, what we don't take is whatever has been pointed out here already. Okay, now here begins my talk. You just have to open your mobile, just switch on the internet. Here, I'm sorry, I think it will be very difficult for you to scan, so you have to do this. Just a bit of interaction. Just go and type polleave.com, which is on your /Pearl Clinic 782. Just have your mobiles on, just type that. I don't know whether you can actually scan this. If it's possible, you can scan. Otherwise, you type it out. It's opening. Is it really possible to scan that? It's too far. Yeah, it's better. Easier one is to type polleave.com. So just to make things interactive. polleave.com /Pearl Clinic. I think Shruti, you can go and scan it directly there. You have come this far. Pearl Clinic 782. Oh, that's fine. That's great. So we all have been telling that the lifestyle has gone vast change, and that's the reason we all face excessive non-communicable diseases. Do we agree with that? Is atherosclerosis a modern disease? Yes or no, or I do not know. See, you can actually skip the you don't need to identify yourself. You can skip and go into the next page. You don't need to. You can just join. Oh. Username is there. Pearl.com, Pearl Clinic 782. It states. On to your left, the Pearl Clinic 782 is there. Many people have opened up, so it's not a difficult one. Well, there is some interaction anyhow. Some people have opened up. You can use it because I think they have got some 5-6 questions for discussion, and that's going to be the basis of today's presentation as such. Well, this is precisely the answer which I wanted. Okay, look at this. Atherosclerosis was very much known even in the Greek-Roman period. Okay, it's not something which is new. It has come up. So why has it happened at all? That then comes the next question. Are you able to see the next question in your screen? You're able to see this. Just I will wait for the answer. So if you want to find whether somebody is at risk, he doesn't have any risk factor, he has come to you, is in the middle age. So as a cardiologist, what should I be advising? Now I generally people go through master health checkup for the one, so they do a lot of tests. What is this ANJI? Somebody has typed it as maybe by mistake. You can always clear it off. Unless you have an answer for that. I'm sorry, I do not know what it is. So this is a screening test, so obviously food habits don't come out there. Okay, ECG and treadmill are taking up a bigger shape, and the answer which I wanted is coronary calcium, which has become smaller. I think only one person has answered there. So there is a link between the first two questions. The first question was basically whether is it an ancient disease. Second question is what is the screening modality. Okay, screening modality is CT coronary calcium. Your treadmill will not identify your okay. That is why people who have done treadmill or people who are in the gym have more cardiac problems than the rest of the population. I'm not going into the details because this is not a forum for that. So the reason for bringing in this question is because the mummies were put through CT calcium. Okay, that was in late 1900s. They were put through CT calcium, and quite a significant number of people, the mummies, I shouldn't be calling people, mummies had coronary calcification, extensive coronary calcification. Now let's go back to those Egyptian times when people did not have much of transportation. Obviously their activities levels would have been good. Tobacco was literally unknown at that period. So we don't have any data on the BP or sugar of those people. And interestingly, these people, the Egyptians, were taking lots of plant-based food. So then why did they have problem? Any guesses? Okay, I know it's a pretty difficult question to answer because all those people who are made as mummies were actually the rich ones. Okay, I made a statement that common Egyptians were taking more fruits and vegetables, whereas the people who were close to king, like the priests, okay, so they were considered as people who were very close to God. Okay, so they made lot of offering to the God. In the name of offering to the God, they were eating lot of rich, so-called rich food. The rich people were eating rich food at that time. Okay. So this I remember the sir was telling that you should go into the scriptures. These are the Egyptian scriptures. Okay, so if you could suggest one which is which I should read, because the next time I don't want to talk about the Egyptian thing, I should be actually talking about the Indian data. Okay, thank you for that. Okay, so you can see that these people are carrying goose, fish, this is a big, what do you call that, anda having lot of cheese. Okay, these are the things. And this is a beautiful thing, the picture showing that one bird, and that's an offering to the god, leg of an animal. Okay, so this is what they were eating, and look at that goose. That was their favorite food, which had so much of saturated fat. Regina was pointing out 63% of fat and 20% goose alone was contributing to saturated fat. So they were eating so much, and so this, what is this? They all believed in afterlife. They lived only 40-50 years. They all believed in afterlife. They all thought if you give so much to the God and take something along with you to offer. So see, this is the what do you call that? Mummies. And these are actually animal mummies which are kept along with the dead person. So they carry all those things along with them to the God. That was the belief at that time. Okay, so all that food, when calculated, they were taking more than 50%. I mean, more than 50% of the fat was coming from saturated fatty acid. And interestingly, I found one more thing in the scriptures. There was one mention about this also, how the priests cheated without even offering to God. They were eating that. So that was also written. This is something funny. We read history that makes it really interesting. Okay, so we go on to the third question. What are the two theories behind atherosclerosis? I'm just, quite a few times I've been giving talk on the same topic with PAN, and I thought my colleagues will get bored, so I thought I'll change 100% of my slides. So I've made an attempt. Let me see how it works. Yeah, nobody has responded yet. Hang tight. So that's a message for me. Responses are coming in. Okay, chronic inflammation has come. I'm just waiting for the one other thing which I need. I'm not talking about the causative agents, it's called theories. Inflammation has come. Yeah, I think fatty, I will take it lipid peroxidation. So these are the two theories. Now why is that which I want? Lipids and inflammation, these are the two important theories, and actually the atherosclerosis is considered equated to a volcano. It just ruptures. Okay, so let's see this. So this is how the atherosclerosis progresses. Can I have a hand mic? So this is how the atherosclerosis progresses, and this is what which you have fatty thickening, small fatty thickening, or the this is some fatty streaks, and then the fatty thickening. I'm sorry for that. So these fatty streaks happen in the first 1 or 2 decades itself. Okay, and if there is a familial hypercholesterolemia, it happens even at birth. These things have been found out in autopsy studies. So this is why we should start the lifestyle modification or the dietary changes right at the time of birth, or at least in the first decade. Okay, we let them grow up to this stage. And just few things about this coronary calcium, this picture. This is, even here, what percentage of blockage is there in with your eyes? Here. This is the lumen. This should be the lumen. So how much of blockage is there here? 40%. So if you do a treadmill at this juncture, this won't be positive. It's all that simple. Okay, there are more reasons for that. Let's not discuss that. And the calcium settles much earlier in these 2 stages itself. And this is the reason why calcium is better than a treadmill. It's not that if you do a calcium and calcium score is 0, you won't have any lesions at all. It's not the case. Okay, because the calcium set happens only in stable plaques. In unstable plaques which have been there for quite some short period, they were not going to have a calcium. So what causes a MI is myocardial infarction is only a soft plaque. Okay, and we are using a crude way to detect only the hard plaques. Fine. You can see, I'm not sure how many of you can see here, the lipid accumulation is one which happens straight away. There are no inflammatory markers at this stage, and here you have a high CRP and high lipoperoxidase here, and here again all the three are elevated. So these are the two theories. Now, thank you. Now if you see this particular slide, so this is association between consumption of foods of animal origin and the risk of atherosclerosis. There is nothing that actually helps out in atherosclerosis. Okay, this is just Dr. Regina was telling that you don't have randomized studies for obvious reasons, and you cannot have a double-blind randomized studies in food and nutrition for obvious reasons. So we have to depend more on the meta-analysis. Okay, so none of the meat product, none of the animal origin products have any positive effect. They may not have any effect. That is different. But none of them have any positive effect. But look at this. Almost everything brings down the atherosclerosis unless you are going to, this is regarding the plant-based diet, unless you have something processed in it. Okay. So we have talked about two theories. One is lipid peroxidation, the other one is inflammatory theory. Okay. So you obviously know that none of the animal products will reduce the lipids, and most of the plant products will reduce the lipids. Okay. This is what I was pointing out. And if you have a whole grain, then the incidence of CVD and the incidence of CVD mortality, both of them come down. And if you are going to take lots of fruits and vegetables along with legumes, everything comes down. If it's going to be a fruit juice, then obviously the reduction, because it's processed, there is going to be a little less effect. Okay. So this is precisely what is called as whole food plant-based diet. That's all. So you are taking whole food, and I'm sorry, this is a plant-based diet, and this is whole food plant-based diet. It's as simple as that. So this is the main reason why it's going to be. Whereas for each 100 grams of meat intake per day, you're going to have a 25% increase in CHT. And if it's going to be a processed meat, it's going to be even higher. So this is the magic of your fruits and vegetables. And what is recommended is around 4 to 6 servings. So that's precisely the reason why I raised my hand, mistaking daily for dairy. I'm sorry for that. Okay, we will get into these things later. Okay, if you're going to take, this is the most important discussion. Forget about all that whole food, plant-based and everything. If there is going to be one single message in the entire session, it's going to be this. So fruits and vegetables. Now, we all tell the patient, no, don't take this, don't take this, don't take this. There is a very simple way to improve the nutrition. Just tell them that you have to, what they have to take. Don't tell them what they should not be taking. And the easiest one is to obviously take care. I'm sure everybody is going to cook some vegetable or other. Just have to increase the quantity. That is the most important thing. Okay. And what is important is even if you're going to take one serving of vegetable, that is going to reduce the coronary heart disease by 4% and stroke by 7%. So that's the most important measure. So what is the second theory? I've talked about the lipids. What about the second theory? It's on inflammation. Okay, there are a lot of inflammatory markers which are mentioned here. Many of them I myself am not familiar with, so I don't want to go into the details, but look at this. Almost all the inflammatory markers are reduced by your plant-based diet, whereas all animal products are basically inflammatory diet. That there is no question about it. There are certain things which don't have any ambiguity. A lot of ambiguity in nutrition, as you were pointing out, but there is no ambiguity about these two things. Okay. So I've asked about two theories. I'm actually going to tell about one more theory. That is the gut microbes. Okay, a small stuff. So if you're going to take non-vegetarian product, this pointer is, this light is not. Oh, okay. Okay, fine. So if you're going to take animal products, then your carnitine choline and phosphatidylcholine are going to go up, and they actually they are acted upon by the bacteria in your gut. They get converted into trimethylamine and the trimethylamine are acted upon by the flavin monooxidase, especially FMO3, and that gets converted into trimethylamine oxide. Okay, forget about this terminologies. So if you are going to have a high TMAO, the likelihood of having a vascular disease is very high. That's all that it is. Okay, it acts on, there are so many pathways. It could be acting on the lipids, it could be acting on the endothelium, it could be acting on the platelets, you know. This is, and of course on the lipid pathway also. Okay, now I'll just project a small study which we did long back. We had 44 patients in the control group and 44 patients in the CAD group. See, the normal value is less than 6.2, and more than 6.2 is something which is abnormal. Look at this. The green ones are the ones which have coronary artery disease. So majority of the patients had very high value of TMAO. This I would like to summarize. This could have been done in a better way by me. So what are the common risk factors? We all know about it. We all know about it. Is hypertension, blood pressure, sugar, obesity, all that stuff. So here actually I have divided into younger and older. This is only about the coronary artery disease patients alone. Okay. So here, all those 4 risk factors, more than 4 risk factors, none of the patients had. That is your diabetes, sugar, pressure, cholesterol. Okay, none of them had. And interestingly, 7 of these patients, 3 on the young side, 4 on the older side, 7 of those patients who had a heart attack out of 44 did not have the conventional risk factors which are done, screened by all of us in a health checkup or following an MI. Whereas TMAO was elevated in 43 out of 44, meaning that the diet plays a crucial role in this group. Okay. Whichever, both ways it's not working. Okay. What happened? This is stuck. Yeah, that's fine. I will take on this question, so I'll address one by one. I'm sorry. So we saw that 4 steps, isn't it? How it was progressing slowly from a fatty streak to a full-blown atherosclerosis. There's one picture going up like this. So what is this single stuff which happens in all these stages of atherosclerosis progression? You just type out, we'll see how many of this get into this. Chronic inflammation and lipid peroxidation happens. That is a basic step. What is the initiating step? I will put the question this way. What is the initiation step in atherosclerosis? Why does the fat get inside the intima? Fat after all travels inside the lumen, isn't it? It flows inside your blood vessel. So why does it get into the intima? I think I have taken you right closer to the answer. Maybe I'll start giving you the clues. This is because of a substance which was considered once upon a time as a environmental pollutant, but we are now targeting as the focus of treatment. Maybe that clue is not enough. This was considered as the molecule of the year in 1992. I hope all of you are awake. I'm not making you to sleep, Yeah, I think we got the answer. Wait, we'll see. Nobel Prize in Physiology and Medicine.
And what was once upon a time was noxious, it becomes notable. I think the answer is right on the this thing. Okay, fine. So that is nitric oxide, fine. So nitric oxide, you're supposed to take something around 2 milligrams per kg, that is around 50 milligrams. But if you follow the DASH diet, I think Regina was showing about the DASH diet and the Mediterranean diet. So if you're consuming a DASH diet, which is not the best of the lot, but that itself gives you around 1000 milligrams per day of nitric oxide. So where does this nitric oxide come from? Green leafy vegetables, fruits and, okay. Okay, we'll see the cycle first. So as she said, it all comes from your greens and beets. Beetroot is the best source for this, okay. So when you take nitric oxide is obviously a gas. It cannot be taken orally. So it has to come from something else. So it is either coming from nitrate or as nitrite. So once you consume that, it goes inside your body, and then in the, okay, it gets absorbed, and then it is again acted upon by the food, the bacteria here. So what happens is the nitrate and nitrate, when they go through the stomach, it's acted upon by the acid, and the nitric oxide is released. So the nitric oxide could be utilized by your body or could be recycled in the form of again nitrates and nitrates, because that undergoes an oxidation and goes back and settles in your salivary glands. Okay, so there are two applied points here. For the nitrate and nitrite to be converted, nitrate to be converted to nitrite, you need the bacteria underneath your tongue. Okay, the anaerobic bacteria underneath the tongue or the ones which convert this nitrite to nitrite. Okay, so if you are going to use excess of mouthwash, you are going to destroy this. And if you are going to take lot of your proton pump inhibitors, which is a common accompaniment in any prescription, unfortunately. Okay, so that is going to again prevent conversion, because you are going to reduce the acid secretion. Okay, there are two important points here. And I think there is one more third important point, because I said this part of it is stored in your salivary glands. For that to come out, you actually got to chew a lot. Okay, there are three important points which I'd like to stress upon. 80 to 85%, as was told, is from the vegetables, and a small bit is from your cured meats. So the meats used to be stored along with nitrates, okay, which were, because then they were considered as carcinogenic and they were reduced. Sources. Well, I will possibly skip if somebody is interested. This is the easiest way to classify the vegetables based on the nitrate content, and look at that, all that green leafy vegetables are the ones which have a very high nitrate content. Okay, animal proteins and animal fats are not prescribed for nitrate content. So third stage also, it's out, the animal part is out. Look at the content in animal and vegetable part. It's a huge difference. So I'll take you through what is supposed to be on this nitric oxide. So this is the endothelium. The innermost layer is called the endothelium, and that's the one which secretes the nitric oxide. So this is how the blood flow. This is this is the largest endocrine organ which is often neglected. That is your endothelium. Okay, I'll just spend some time on this, even if I'm going to skip the rest of the slides. So this is the endothelium which gets broken for some reasons, and the fat starts getting deposited. Okay, this happens multiple number of times every day in every one of us in multiple places because of the wrong eating habits. You can say that I ate only one burger. That one burger is good enough to have a endothelial damage. Okay. So I had one piece of mutton. That one piece is good enough to cause that. That is not going to cause a heart attack. It is going to cause fat deposition inside your intima. That's all I'm saying. So this is happening multiple times and this just progresses. And your plant-based food is supposed to release nitric oxide and will promote the endothelial healing. That's again one more stuff. So at some point of time, the endothelium over this block gives way. And as we all wait for this to happen, unfortunately, as this happened here. So this, from this to this, it would have taken decades, and from this to this, it takes just a fraction of seconds. Okay. So endothelial function gets improved only on a plant-based diet. So we're going on to the next question. What are the two drugs which are used in primary prevention of CVD? Just please get it typed. Get it typed, please. I'd like to see the answers on the screen. Okay, statins whenever you want a prevention, and aspirin is definitely, I mean, it was there earlier, but it has been taken out and it's been reserved only for a few subset of people. Okay, I will not touch upon that now because that's not the agenda now. Okay, now why should we, do you think, again, why are we giving statins? Basically, we want to reduce the lipid load. Okay, so obviously we know that the animal fat is not going to reduce it. There is no discussion on that part at all. So well, the second part of this discussion, I'm not going to be here on stage. So last time I was told that the question might come on why not a plant-based diet alone instead of a statin for a primary prevention. So I'm taking up that question right now. So how many of you say that it's enough if you just put them on a diet, or how many of you say, what is the pros and cons of using a statin versus a plant-based diet? Has it been studied at all? Maybe for the later question I will answer because I have done some homework. There cannot be a bigger study on plant-based diet versus statins. Who will sponsor that? So it's never going to come, okay? So I think it came up some 3-4 decades ago with the first statin called lovastatin, which is, I don't know whether many of these youngsters would not have even heard of lovastatin, where the efficacy of statin and lovastatin was the same in that group. After that, we have had potent statins, but we have not had any studies. So that part is out. Okay, so how do you compare, what are the pros and cons of having statins versus plant-based diet? So instead of them asking me, I'm asking the question now. Meaning? If you have severe disease, it's better not to wait and start statins? Is that what you're... We need both. Okay.
Alone as a plant-based, because we combine food with some cereals.
No. When you say whole food plant-based diet, it involves the whole thali which we have minus the animal product. So it's not like that. Well, so these are my answers. It's easy to take statins, and it reduces fast, and there is no preparation needed. You just have to gulp and go off. But that's not the thing, okay? So statins also produce diabetes in 33% of the individuals, at least 20 to 33. The incidence varies, and there is no myopathy, so it doesn't come with a side effect. And obviously, statins will not reduce other risk factors. Say, for example, it will not reduce the blood pressure, it's not going to reduce the obesity. It might act on the vessels, but it will not reduce the comorbid factors. But plant-based diet, yes. So even if the patient is on statins, it just means, as you were saying, it has to be accompanied by a lifestyle modification where the plant-based diet should be the predominant stuff. So obviously you know that there is no animal source, and I also included aspirin, isn't it? Aspirin is reserved earlier they said aspirin as a part of primary prevention strategy. Now it has been taken off from all the guidelines because you have to balance between the risk of side effects versus the benefits. So it is reserved only for those people who have a higher amount of coronary calcium. Okay, that becomes an indication, unfortunately. So, why did I bring up this at all in this topic? Does it have anything with the food? Yes? I'm talking about aspirin and the plant-based diet.
Plant-based diet naturally thins out the blood. Natural blood.
I was surprised to have one of like this. Okay, I saw one right up like this, and then I started searching. There was a lot of plant-based salicylates available. Okay. Okay, I think this I will go fast. Which of the following are considered as conventional risk factors for coronary artery disease? All of them. I'm putting all of them in these lines. Diabetes, inactivity, elevated lipids, tension is what? Both stress and hypertension. Abdominal circumference refers to your obesity. Risky substances like smoking, XY. Put everything together, there is a big dietary cause. Isn't it? Okay. Now, how diet plays a role in each of these risk factors, I think it itself becomes a very big topic, but I am not going to touch upon that. What I learned as new, that is the only thing which I have projected here. There are a lot of things which reduce diabetes because regarding the plant-based diet, that is because they contain so many of these substances. Exercise, it promotes weight loss, it increases the exercise performance, and it's an immediate source of energy. Sharon is looking, I'm not covering your area at all. And the most important thing is this also I will skip. Well, this is something which I wanted to project in the Olympics in 2012. This was beetroot juice was included as their official drink. Okay, so it increases the exercise performance. Well, these things I will skip. A lot of things regarding the stress, how the plant-based diet promotes this. Yeah, this is something interesting. I made a presentation in the ISLM on the blood pressure reduction with lifestyle. What extra is there, which I read few days back. I saw that there is an AC inhibitor-like effect in various plant-based diet. Okay, so I will skip this also. Then, yeah, this is something which I thought was. Oh, I'm sorry. Yeah, smoking-induced atherosclerosis is reduced by certain food substances. That was also something which was very interesting. May not have time to go and read about all these things, but you can take a photo if you are interested. And it does play a role in genomic studies. Regina asked about one study, whether you people have seen in Netflix recently. You are what you eat. That's based on that's a twin study where they actually gave a plant-based diet and followed up for a very long time. Okay, so the plant-based diet can actually influence the genetic stuff also. Well, I think this is the last question, but I got plenty of slides after that. Okay, what are the two guidelines which people generally follow up? When you say hypertension, when you say diabetes, when you have IHT, what are the two guidelines? Guidelines. Two countries from whom we take all those stuff, AHA and ESC, European Society of Cardiology. Okay. So just summing up what is given in these guidelines. One is about the energy expenditure and energy intake balance. Take plenty of fruits and vegetables. Choose foods which are whole grains. Whatever we have been telling, this is what has been found as in the guideline. The only thing is they still promote oil. I will come to that later. Liquid plant oils rather than tropical oils. And lot of proteins. Say the first sentence is the most important thing, mostly from plants. So they all say that uniformly. So there are these are 5 important points. 6th is minimally processed foods instead of ultra processed foods. minimal intake of beverages and fruits with added sugars. All these things are to be reduced. That's what they are saying. Choose and prepare foods with little or no salt. If you don't drink alcohol, don't start. If you choose to drink alcohol, limit. And wherever you go, just follow this. Okay. So, basically we know the guidelines are to a larger extent dictated by the industries, very unfortunately. So, whatever is to be taken in a large amount, they have accepted. For the rest, they have come to moderate. From that, now they have reduced it. That's what's happening. So a lot of people are pushing for change. So things are happening. And what unfortunately has happened is, the plant-based diet group also, when the definition was whole food plant-based diet, sticking on to 100% plant-based diet, possibly for increasing the acceptability, they have come down that you can use minimally processed foods and less animal products. So both ways they have the associations, American Heart Association and the ESC have come down a bit, and the plant-based diet also, these people have come down it. I think that's also for good only. Okay, I don't think Sharon will say that totally you should stop eating animal products, because it's not going to be practical amongst it. Okay, we'll as far as possible stick to that. Okay, and this is again the AHA recommendation. Well, I'll just a minute, I'm sorry for that. Okay, is it visible? Okay, I'll take it now. Look at this, how they have classified. This is basically, it is a practical guidance for food consumption to prevent CVD, which has come in 2000, as early as 2021. And look at this, people have been classified into high risk and moderate risk with existing scoring systems, and people with low risk and moderate risk. So very high, moderate and low. How they have divided? Amongst the plant foods, it's almost the same for both. Only thing is, in low risk category, they have allowed frozen and canned. Okay. So unrefined carbohydrate, again they say that vegetables, your chickpeas, brown rice, and all those things. But if you are at low risk, they say white rice and pasta, preferably wholemeal. Okay, fine. Coming to fat, saturated fat including dairy, they say limit. But here they have gone little more. They said cheese, yogurt, milk, ice cream, cakes have been included under low to moderate risk. Okay, similar thing. Again, about the fish, they have included only specific fishes for the high risk group, whereas they have included all fish and shellfish. I think it is very selfish of them to have included this. Well, red meat, they have limited the numbers 2 to 3 times a week, and as here it's the same. Look at they have given some lenience for people who are at low and moderate risk. Who are the people who are going to become high risk? The ones who are at low risk and moderate risk are the ones who are going to give. Are we going to screen them every day, every year? Are we going to do a CT coronary calcium? Is CT coronary calcium going to prevent an event? No, not at all, isn't it? Maybe because they wanted adherence, they wanted people to have a sustained food, they have come down. This is, we can presume so, but it's mostly under the influence of the industry. Well, I will possibly skip these slides. I will come to, okay, I'll come to this. How much should we take? Every meeting ends up without knowing what is to be taken, how much is to be taken. Now look at this, all that green, yellow, this is a typical traffic light. Okay, the greens, 2 servings of each, vegetables, 2 servings of fresh foods, 2 servings of whole grains. That is something which is important. 1 serving of low glycemic refined cereals, this is what we take predominantly, unfortunately. Nuts and seeds, again 1 serving, again your yogurt and extra virgin olive oil. This is of course taken from the American guidelines, so it has to be like that. And legumes, at least 4 servings per week. Other 2 things we said per day, here it is per week. If you are going to take non-veg, look at the amount that has been prescribed. Isn't it? Occasionally processed meat, that basically means it's better not to take it. No more than 2 servings per week of high glycemic index refined starch foods, red meat and butter. That is no more than 2 servings per week. And no more than 3 servings per week is your white meat, egg, cheese. So whatever has been reduced has come here. Does it not ring a bell? It is exactly like a whole food plant-based diet. Okay, that's the best diet for the. So I said servings. Okay, these come good examples. I said servings. It is always confusing to know what it means to. So instead of you can see this. If you are going to take a high diet in red meat, what does it mean? It means 23 grams per day. That's it. If you are going to take a high processed meat, it should not be more than 2 grams per day. Okay. I'll be finishing in few minutes. So this is your plant-based diet. This is how it should be. But we are in this stage. It's important to progress to this stage. So the CVD prevention, for that sake, NCD prevention revolves around whole food plant-based diet. Thank you. I request to Dr. Sharan. Sharan is the next speaker, and I will be leaving to the next hall for a presentation with chefs. Okay, there is an initiative by the PAN to make chefs work for a better health, just not for taste. Okay, so I will take a few questions if there are any. Yes, sir. Well, the topic was on CVD, but of course it has to have all the NCDs. There have been plenty of programs going around the globe as far as the diabetes reversal is concerned with the whole food plant-based diet. Let's forget about the whole food plant-based diet. Let's just talk about the diabetes reversal. The reversal term has been literally taken off. So they want us to use the word remission because we do not know how long it is going to sustain. So there are 2 schools of thought as far as whole food plant-based, 2 schools of thought as far as diabetes remission is concerned. One is with an extreme calorie restriction. That was the one which was followed by Roy Taylor, and that is predominantly talked about. The second is one where the whole food plant-based diet helps. That is by Neil Bernard and co. So if somebody is very interested in learning about the whole food plant-based diet, I would call him as the father of diabetic remission. So I will recommend you to go for this, and we are starting a program soon with this. Basically, this whole food plant-based diet is a low-calorie diet. Whatever Roy Taylor said is also incorporated, but only thing is here everything is good food. So it's other point which I would like to mention is let's not focus on the risk factors alone. Controlling the diabetes with some awful diet should not lead on to IHT. There are a lot of diets which have been shown to reduce the sugar levels, shown to reduce the obesity, tummy. People have a weight loss very fast, but they all die of CVD early. Well, I'm going to be available during the lunchtime. If you have any queries, we'll catch up. And Dr. Suresh will be taking up the cardiology questions in the panel discussion. Thank you.